Good morning, one and all. I, Dr. Sindhuri from Department of Conservative and Endodontics from Mallareddy Institute of Dental Sciences. Today is hereby to present that on topic hand instruments in operative dentistry. So coming to the contents, it is introduction, instrument designs, classification of instruments, techniques of grasp, sharpening of instruments, sterilization, conclusion and references. So introduction, the early hand operated instruments are characterized by large heavy handles and inferior metal alloys in the blades, cumbersome, difficult to use and ineffective in many situations. There was no uniformity of manufacture or nomenclature. Many dentists made their own hand instruments in an effort to find a suitable instrument for a specific need. Effective sterilization was a problem. So G.V. Black is credited with the first acceptable nomenclature and classification of hand instruments. His classification systems enabled dentists and manufacturers to communicate with the code and a standardization which were effectively regarded as a good instrument design and function. So these were the first instruments which were designed by G.V. Black. And coming to the materials which with the instruments were made, they are carbon steel, stainless steel, and the others in minute quantities are nickel, cobalt, chromium and iron. Then again we come into the material classification. Carbide inserts were more durable, have good cutting edges and harder, wear resistant and brittle, but when unprotected it was subjected to corrosion. And then stainless steels remain bright but loosen keen edges during use much more quickly. Chromium corrosion resistance. So stainless steel had the requirement to be constantly sharpened for multi-usage purpose, and always sterilization was a part of this part. And coming to heat treatment. So heat treatment is hardening. Hardening alloys but makes brittle, especially when carbon content is high. Tempering relieves strains and increases toughness. So coming to the instrument designs, the instrument is basically categorized into three parts. That is, the first part is the blade, then the connecting link between the blade and the shank is nothing but the connecting link between the blade and the handle is the shank, and the blade, so and the first blade has a primary cutting edge, and we have two types of edges, that is primary cutting edge and there is a secondary cutting edge, and the tip of the blade is otherwise called as the nib. So coming to the blade, this is the working part of the instrument, begins at a point which terminates the shank. It is connected to the handle by the shank. Each blade has a cutting edge which is the working part of the instrument. It is usually in the form of a bevel, acute angle that cuts into the tooth structure. The bevel is the area where the primary cutting edge is present, and that is the area where it is used to cut the tooth structure. And on non-cutting instruments example, these are which are used only for the facilitate the process of the material placement in the cavity. So it can be which are not used for cutting of the tooth structure. They are condensers sometimes, and condensers, carriers and all. So one of the part is condenser. The part corresponding to the blade is called the nib or face. So coming to the next part, that is shank, that connects the handle to the working end of the instrument, and normally smooth, round and tapered, having one or more angles. To avoid twisting of the instruments, hand instruments must be balanced and sharp to enable efficient working on the cavity preparation or the cutting on the tooth structure. Balance allows to concentrate force on the blade without causing rotation of the instrument. Balance is accomplished by designing the angle of the shank so that the cutting edge of the blade must not be off axis by more than 1 to 2 millimeters. Shank angles are based upon the angulations present. It can be mono-angled, bi-angled or triple-angled. Instruments with short blades may be mono-angled. Instruments with long blades may require 2 or more angles. So just these are a few diagrams which show us the mono-angulation, where the first diagram depicts the single angle, and here the bi-angled is an example of a spoon excavator, where you can see it is when it's split into two halves, it has two angulations, and then it's triple angled. Coming to the next thing is the handle. It is the part of the grasp in the operator's hand perfectly straight, smooth or 8-sided, serrated for better gripping and control of the instruments. Handles are in conjunction with shank, or it may be used for separation, and sometimes it can be changeable, like example mouth mirrors. Separate type is known as cone socket handle and allows for the replacement of several working ends, example mirrors and condensers. The handles are various sizes and shapes, but few standardizations are given in such sizes, that is 1/4 inches 6.4 millimeters and 3/8 inches 9.5 millimeters and 7/16 inches 7.9 millimeters. The shapes are the different types of shapes upon which the handle is manufactured. They are 8-sided and knurled, and then serrated and tapered and padded. So this is the next thing in the instrument. We have a instrument formula. According to standardization, we have a set of instruments. So each instrument is categorized with a 3-numbered formula or a 4-numbered formula. Yes, so and here in this diagram we can just see how the numbering is given. So instruments, this is present on the handle. The 3-numbered formula or the 4-numbered formula is present on the handle, and then here we can appreciate the first number indicates the blade width, and the second is the cutting edge angle, and the third is the blade length, and the fourth is the blade angle. So detailed description we are just in the ongoing slides. Hand cutting instruments have formulas describing the dimensions and the angle of the working end. Thus it will facilitate the easy use of the instrument. These are placed on the handles using a code of 3 or 4 numbers separated by dashes or spaces. So we can see this is the 4-numbered formula here, and which are categorized, and each number is separated by using dashes. The first number indicates the width of the blade in tenths of the millimeters. So the unit of the first number is in millimeters. So 10 is, if the first number, if it is given as 10, then it indicates it is 1 millimeter of that particular instrument. The second number, primary cutting edge angle measured from a line parallel to the long axis of the handle, is in clockwise centigrade. Here we know that, so the first number is measured in millimeters and the second number is measured in centigrades. If the edge is perpendicular to the blade, this number is omitted, resulting in a 3-numbered code. So this is the main area where it is distinguished between a 3-numbered formula or a 4-numbered formula. If there is an omission when the edge is perpendicular to the blade, then it becomes 3-numbered code. So the third number indicates in that numbered formula is 8 millimeters. The fourth number indicates a blade angle relative to the long axis of the handle in clockwise centigrade. And the additional number on the handle is the manufacturer's. Sometimes there is an additional number which is manufacturer's identification number. So as we have read earlier that there is a blade and which has a primary cutting edge and a secondary cutting edge. So the primary cutting edge, when it is present, it is in a beveled format. So the most hand cutting instruments have on the end of the blade a single bevel that forms the primary cutting edge, and the most additional 2 secondary cutting edges are present beside the primary cutting edge, and this allows cutting in 3 directions: facial, lingual and the proximal cavity. So we can appreciate these parts in the diagram. The end part is the primary cutting edge, and the sides which are there between the primary cutting edge are the secondary cutting edges. So this is the instrument which is shown here as a chisel. So these are single beveled instruments are used with lateral cutting movements. These are example. This is a GMT, this is a gingival marginal trimmer, and the main use of this instrument is it is used to remove the weakened enamel and dentinal structures. So there are bibeveled instruments have 2 bevels that form the cutting edge, that is the hatchet and the excavator. As you can see the cutting end here, which and the beveling at that part. So coming to, we have 2 types of bevels, that is right and left bevel. So how can we categorize an instrument is angulated in a right or a left phase? Let us see. To determine this, the primary cutting edge is held down and pointing away. So if the bevel appears on the right, it is the right instrument. If the bevel appears on the left, it is the left instrument. So the opposite is true for the left instrument of the pair. So one instrument is used for work on one side of the preparation and the other for the opposite side of the preparation. So Black classified all instruments by name according to function, manner of use and the design of the working end. So let's categorize broadly the instruments as with function, that is scaler or excavator, and the manner of use, it can be used as within push or pull, and then design of the working end, that is spoon, cleoid, discoid and hatchet. So shape of the shank includes monoangle, biangle and contraangled. These names were combined to form the complete description of the instrument. Example, biangle spoon excavator. So this is a gross description of the classification and how it is classified based upon the cutting and non-cutting instruments. And in cutting instruments we have excavators, chisels and others, and non-cutting we have amalgam, condensers, mirrors, explorers, probes and others. So in excavators we have ordinary hatchets, hoes, angle former and spoon excavators, and chisels we have straight chisel, curved chisel, biangle chisel, enamel hatchet, gingival margin trimmer. Others we have files, scalers and carvers. So let us go for a brief description about each instrument. So we have different authors and they have categorized them based upon their particular criteria. Into cutting instruments we have hand, rotary, and this classification was given by Charbonneau and Studwent. And hand cutting instruments which include chisel, hoe, excavators and others, rotary which include burrs, stones, discs and others. So then we have condensing instruments. These are pluggers, hand and mechanical condensing instruments. And plastic instruments we have spatulas, carvers, burnishers and packing instruments. So coming again to the fourth criteria, that is the finishing and polishing instruments, we have hand, orange wood stick, polishing points, finishing strips. And then rotary we have finishing burrs, mounted brushes and stones, rubber cups. And then again we have impregnated discs and wheels. So coming to the isolation instruments, there is in conservative and endodontics we have a particular methodology or for a isolation of the in the oral cavity, and one such methodology is the use of a rubber dam. So in this we have isolation instruments. Those are nothing but the rubber dam frames. The rubber dam is a unit and it has these kind of sets or units in them, that is clamps, forceps and punch. And then we have saliva ejector, that is cotton roll holder, evacuating tips and equipment. So this is the complete rubber dam unit which is used for the isolation in the oral cavity for a particular tooth. So the basic use of the rubber dam and its use is it avoids the swallowing of the instruments, and then it allows the operator for a proper visualization of the tooth which is present, and it has many number of uses, like the blood spillage or the saliva from the patient is not a hindrance while treating the patients. Moving on to the next slide, these are the clamps. These are the various clamps which are used. So these are the clamps which are used for the anterior teeth and the posterior teeth, and there is a specific clamps for premolars and molars and incisors which are used. So coming to the miscellaneous instruments, we have mouth mirrors, explorers, probes, scissors, pliers and others. And this is the second classification, that is according to Marzuk. These are exploring instruments, mouth mirrors, explorers, periodontal probes, cotton roll tweezer, instruments for tooth structure removal, hand and rotary. Restoring instruments are spatulas, plastic filling instruments, amalgam carriers, condensers, burnishers, carvers, files and knives. So the application based upon the use or the application can be classified into hand cutting instruments. Those are excavators and chisels. So the excavators are used for the removal of caries and refinement of the internal parts of the preparation, and the chisels used primarily for cutting of the enamel. So coming to the excavators, these are subclassified as hatchets, hoes, angle formers and spoons, and the anterior teeth, retentive areas and sharpening internal line angles and gold restorations. So that is hatchet, excavator. And for planning tooth preparation walls and forming line angles, class 3 and 5 preparations for direct gold restorations, they have longer and heavier blades with contra-angle shanks and used for posterior teeth, and that is the hoe excavator. And it is used primarily for sharpening line angles and creating retentive features in dentin in preparation for gold restorations. It also may be used in placing a bevel on enamel margin, that is nothing but the angle former excavator. And it can be a mono-angled and has primary cutting edge angle and the other than 90 degrees to the blade. It is available in pairs, right and left. So the next instrument is the spoon excavator. Its blades are slightly curved. The shanks may be thin, angled or triple angled to facilitate accessibility. And the spoon excavators, based upon their shape, they can be of discoid and cleoid. So the cutting edges are circular in nature for spoon excavator, and the cutting edges are claw-like for cleoid type of spoon excavator, and they are circular for discoid. So this is a bi-angled spoon excavator, and this is a triple angled spoon excavator, and the below one is a cleoid kind of spoon excavator. And coming to the discoid spoon excavator and its usage. So here we can see this class, here it is a class 2 cavity on a premolar, and here the discoid spoon excavator, it is used in a restorative purpose. And coming to the next part is the chisels. So as we have seen, chisels, they are mainly categorized in the beveling at the primary cutting edge angle, and they are of 3 types, that is straight, slightly curved or bi-angled, and we have enamel hatchets, gingival marginal trimmer. So based upon the usage, it has been classified here. So these hatchets are used in enamel region, and gingival marginal trimmer are used for to remove the weakening part of the enamel structure. The straight chisel has a straight shank and blade with the bevel on only one side. Its primary edge is perpendicular to the axis of the handle. And then we have the bi-angled chisel. It's otherwise called as Weddell-Sterrett design chisel, and then it is slightly curved at the blade region. And then coming to the enamel hatchet, it is used for cutting enamel and comes as a right or left types for use on the opposite sides of the preparation. And then that is a gingival marginal trimmer. So here it is this instrument is has right and left types, and it is of mesial and distal type. So when the second number in the formula is 90 to 100, it is used for distal gingival marginal trimmers. So one of the point where it can be differentiated from mesial and the distal gingival marginal trimmer. When the number is 75 to 85, the pair is used to bevel the mesial margins. So left pair is for the mesial or distal margins, and the right pair is either for the mesial or distal gingival margins. And the diagram depicts the mesial and the distal angulation. So this is the important instrument in the whole hand instrument, that is because it has many uses. And these are the beveling of gingival margins of proximo-occlusal preparation and beveling of the axiopalpal line angle, performing a gingival lock reverse bevel placed on the gingival seat, and GMT 100 for the distal and the GMT 75 for the mesial. So one of the difference between the distal and the mesial GMT. So coming to the non-cutting instruments, these are amalgam condensers, mouth mirror and others. Amalgam condenser it is a dental instrument used for compacting silver amalgam while in plastic state, used for restoring teeth to a natural contour. Condensers some come in single and double-ended designs. They have various shape and sizes, working ends which may be smooth or serrated. So the most commonly used are parallelogram condenser and the cylindrical condenser. So these are as we can see, these are the condensers which are used regular pattern, and we can see the cylindrical condenser and the following condensers. So we coming to the next diagnostic instrument, that is the mouth mirror. The mouth mirror or the dentist mirror is an instrument most commonly used in dentistry because it's the first step in diagnosing of any of the pathological error or like dental caries or any kind of diseases can be identified with the mouth mirror on the tooth surface. The head of the mirror is usually round, and the most common size used are the number 4 and the number 5, and the number 2 is sometimes used when a smaller mirror is needed, such as when working on back teeth with a dental dam in place. So there are two types of surfaces. One is the rear surface and one is the front surface. It is the most important functions are allowing indirect vision by the dentist, reflecting light onto the desired surface, and the second most common function for the mouth mirror is a retraction of the soft tissues. So as we can see here, the usage of the mouth mirror for the diagnostic purpose and for the working purpose is seen here. And then the surfaces can be seen here. And coming to the others, what are the miscellaneous instruments which are used? That is carvers. After the amalgam is condensed, it must then be carved to approximately the same original tooth structure. That is how the normal anatomy of the normal contour of the tooth is replicated, and the instrument which is most prominently used here is the carvers. And carvers have sharp cutting edges that are used to shape, form or cut tooth anatomy into amalgam restorations, and few of the carvers are Hollenbeck carver, discoid or cleared carver, Fraham's, or it's otherwise called as diamond carver. So each particular side, each particular carver is used. Hollenbeck carver is used for the sides, occlusal, proximal, buccal and lingual, and discoid cleared carver, occlusal portions of amalgam, and the Fraham's and diamond carver are used for proximal portion. So coming to the disposable brush, it is used with etching and bonding procedures exclusively for composite restorations. Associated with composite resins in a materialistic aspect is a disposable brush with a reusable handle, aiding in a good infection control practice. And there are other parts, the burnishes. When the carving is complete, the dentist may use burnishes. Why? Means to have the smooth and polish the restoration, remove scratches left on the amalgam surface by a carving instrument. And disposable brush, you can just see here, this is a newer advancement in this thing. And files to trim overhangs of the amalgam restorations at proximal and gingival portions, and the knives to cut the excess material, and trimming excess of restorative material from different areas of tooth surface, that is in GIC and composite restorations, and finishing amalgam and DFG. Finishing strips coated abrasive particles to finish the proximal surface of restoration, and that is example aluminum oxide, sand, cuttle, garnet, silicon carbide. And the periodontal probes to measure pocket depth, cavity measurements, explorers. And the instrument grasps are, there are 4 grasps used with hand instruments. What is the essentiality of the use of the hand instrument grasp is, it facilitates the holding of the instrument properly. And there is a standardization, and there are 4 different types of grasps here, and 2 are of pen grasp and 2 are of thumb grasp. There are modified pen, inverted pen grasp, palm and thumb grasp, modified palm and thumb grasp. With each grasp, proper rest and guard is important. So let us see about the modified pen grasp. So what exactly is the use of the fingers here? Like how are the fingers modulated to use are in holding a pen, except it's like a same holding of the pen, it's there, and how the fingers are aligned is the thumb, index and the middle fingers contact with the instrument, while the tips of the ring and the little fingers are placed on the working teeth and a rest. So the palm of the hand is facing away from the operator. You can just see the first picture depicts the pen grasp, and the other thing is the modified pen grasp. And the inverted pen grasp are, if the hand is rotated so that the palm faces more towards the operator, it can be used for the posterior teeth of the maxillary region. And the palm and the thumb grasp are, so this is the grasp which is called as a grasp of power. The handle of the instrument is placed on the palm of the hand and grasped by all the fingers, while the thumb is free of the instrument, rest on the nearby tooth of the same arch. So we can just see the palm and the thumb grasp, it's used here. It's a modified palm and thumb grasp, the same as in the palm and thumb grasp, but the thumb is rested on the tooth being prepared. So this also has its use in the upper arch. And coming to the instrument rest and the guards. Indirect rest may be gained by using the index finger of the opposite hand to rest on the shank of the instrument. The operating hand rests on the opposite hand, which rests on the stable oral structures. A proper instrument grasp must include a firm rest to steady the hand during the operative procedures, and the support may be gained from hard tissues. Coming to the guards, the use of the interproximal wedges to protect soft tissues from contact with sharp rotary cutting instruments. And the most important step in hand instruments is sharpening of the instruments. So mostly the materials used are of carbide or stainless steel, so they require the constant sharpening of the instruments to maintain the efficiency in cutting of the tooth structure. The cutting edge of the hand instrument should always be kept sharp in a ways. If the dull instruments may cause loss of control, more pain and prolonged time for the operative procedures, and reduce the quality and precision of the tooth preparation. And coming to the sharpening equipment, so these are the materials which can be used for the sharpening of the hand instruments, and those are Arakna stone, silicon carbide, aluminum oxide, and diamond. So this is the mechanism how we use to carve the hand instrument or the sharp the hand instrument. The mechanical sharpeners are moved to a low speed while the instrument, so in order to save the time during the mechanism of sharpening, you can use a mechanical sharpener, that is which operates on a low speed while the instrument is held at the opposite angle and is supported by a rest, that is easier and less time consuming. So coming to the principles of how the hand instrument is used, that is sterilization, proper bevel, light stroke, rest to guide, remove as little as blade from the blade, and hone the unbeveled side, re-sterilize, clean and free of the metal cutting, sharpening stones. And regarding to the chisels, hose, hatchet, GMT, amalgam or gold knife, spoon excavator, and the concluding. So I want to conclude my presentation today. It's a brief description of how the hand instruments are used. Although we are in an era of we are using all the rotary equipment and the advanced equipments which consume less time, but in a cases where there is an initial lesion or a very minute thing, you can always go for a hand instruments. And to preserve the tooth structure, I think the hand instrument play a major role. Thank you. These are my references.